What is it like using health and care services when you have sensory loss? Project findings, January 2026, Healthwatch Lincolnshire. Part of our 2025-2026 annual work plan focused on engaging with seldom heard communities. Throughout all our projects, we strive to ensure we are hearing from a diverse and inclusive range of people. However, during July to September 2025, we wanted to focus on one community to explore their experiences of health and care services in more detail. This allowed us to identify key issues, concerns, and best practice to improve experiences of health and care. The project focused on those with sensory loss. We decided to focus on those with sensory loss because in 2022 we conducted a piece of work on the Accessible Information Standard, known as AIS. Under AIS, you have a legal right to health and social care information in a way you understand and communication support if you need it. The findings from our 2022 report showed that despite the AIS, individuals in Lincolnshire were struggling to get information and communicate with services in a way that met their needs. We continue to hear these concerns to this day, despite the latest version of the AIS being published in June 2025. Therefore, we decided to engage with those with sensory loss to understand their experiences of health and care services. The findings from this work would also feed into the Engaging Sensory Impaired Communities in Lincolnshire joint engagement plan between Lincolnshire County Council, NHS Lincolnshire and HW Links, who runs the Healthwatch Lincolnshire contract. Based on our experience of working with those with sensory loss, we decided the most appropriate form of engagement to understand their experiences would be through community conversations. Our engagement officer and volunteers attended 6 community groups for those with sensory loss across the county. More than 120 people were present in total, including those with sensory loss as well as individuals that support them. So, what did people with sensory loss tell us about their experiences of health and care services? The findings could be split into 3 broad but interlinked themes, which were access, communication, and practical support and adjustments. So, access. Something that was highlighted to us was that it is crucial that there are multiple ways to book an appointment, this mainly related to GP surgeries and practices. Some practices appear to be moving to one way of booking appointments, which was not always suitable. For example, having to ring is not possible for someone who is deaf, and they may find it easier to book an appointment online. However, booking online can be hard for someone with vision loss, and they may prefer to ring to make an appointment. These experiences highlight the importance of having options, as individuals have different needs. The quote on the right highlights a real lived experience, with one individual highlighting that the biggest barrier for them was booking an appointment at their surgery. The patient is not able to ring themselves due to hearing loss, and the surgery will only accept phone calls to book an appointment. The patient then has to go into the surgery to book a date and time. The surgery is shut at the weekends, and therefore the patient has to wait longer for an appointment. Access continued. Dental services also appeared to be particularly difficult for those with sensory loss to access. Experiences were shared where staff did not understand or respect their communication needs, such as not using language line or interpreters. Reluctance to allow assistance dogs in dental settings was also discussed. Again, 2 real lived experiences highlighted this. The dentist is using language line but refuses to bring in someone face to face. The patient finds it difficult to see what's on the screen. Another shared, one patient mentioned that their dentist does not want the assistant dog in the consulting room as it was a clinical area. The second theme related to communication, both about and during appointments. Experiences were shared where interpreters had not been booked or used, and there appeared to be sometimes confusion around whose responsibility it was to book an interpreter. Others shared their experiences of communication needs not being respected, such as letters not being sent in large print. Issues during appointments again related to using interpreters and also when clinicians did not talk to the patient but instead spoke to the interpreter. There's also an incorrect assumption that those who are deaf can always lip read. The final theme related to practical support and adjustments. This included ensuring that blister packets are supplied for medication, as this allows those with vision loss to independently track whether they have taken their medication, preventing missed doses and them from taking too much. As discussed earlier, individuals highlighted the need for clearer guidance and awareness of where assistance dogs can go in healthcare settings. This included dental and hospital services. Finally, this theme also included reviewing processes. Processes may look very different for someone with sensory loss, and it is crucial they are involved in designing these processes. For example, an experience was shared where a person with hearing loss was sat in a waiting room. A clinician came out to call them in for an appointment, but the individual could not hear them. They then also went on to fail a sight test as the clinician could not communicate with the individual where they needed to look. Another example shared related to an individual with vision loss being asked to check for blood in their stools, which was not possible for them. These experiences highlight the need to ensure that processes are inclusive to those with sensory loss. Good practice. There was an example shared where an individual with hearing loss needed to access emergency care. The individual shared the adaptations that could be made in such a setting where it is often not possible to book or find an interpreter. Beneficial adaptations that were made included using language line, pictorial sheets, speaking to the patient so they could see their faces and lip read, as well as writing things down. This experience shows how small adjustments can greatly improve experiences of care. Next steps. The findings from this work have already contributed to the joint engagement plan between NHS Lincolnshire Integrated Care Board, Lincolnshire County Council and HW Links. Based on the experiences shared, we recommend the following are explored in more detail to improve experiences of services for those with sensory loss. Firstly, experience of dental services. Talk to patients and professionals working in dental services to understand the barriers they face and identify ways forward. Review how communication needs, such as needing large print, are identified and met. Review processes. How do they look for someone with sensory loss? Make sure they are involved in design. Also, how are healthcare professionals supported? What training do they receive to support and care for those with sensory loss? What would be beneficial for them to receive? Our report on this project will be published shortly.